It's a difficult story to tell.
On board, I have a 29-year-old female patient who is 32 weeks pregnant.
Homeless, addicted to fentanyl, and pregnant. A woman goes into labor on the streets of Southwest Portland, right across from a fire station.
No pain at this time. We did use fentanyl about an hour ago.
That chilling call came in 2 weeks ago. KGW met the woman at her tent this week. She did not want to share her story on camera, and her baby remains in the hospital.
It's tragic. As a pediatrician,
Dr. Dimitri Duchovny is the medical director of OHSU's neonatal intensive care unit.
So I take care of babies when they're born and they have exposure to opiates.
He says they're seeing an increase in the number of babies born addicted to fentanyl.
The use of fentanyl has increased quite a bit in pregnancy just in the last few years.
Doctors are still learning how to treat a newborn withdrawing from the drug.
Some of the things that we're seeing is around the withdrawal starting out early, like it starts almost right away and in the first 12 to 24 hours of life, versus some of the other opiates. We know it's a huge problem, and it's a huge problem for that person and not getting the necessary care that they're getting during their pregnancy.
The first responders were called to help the woman who went into labor in her tent numerous times, offering treatment and housing, but she declined those services.
Our outreach team has made contact with them.
A team of Multnomah County outreach workers continue to try and help her.
I think it highlights the complexity of what we're dealing with in our community. There's tons of folks in our community that need a higher level of support, but the way our system's set up and the way that it functions right now, it's individual's choice.
Leaving them with no other option than to keep trying.
We never know if it's going to be the first attempt or the 100th attempt. And if we don't provide that 100th attempt, we're never going to find out if that person is ready to receive care.
And Blair joins us now. Blair, we've received a lot of questions from our viewers about this, and one that keeps coming up here: could the state have intervened in this particular case during the pregnancy, even if the mother did not want help?
Well, David, the Department of Human Services told me that Oregon law prevents them from stepping in before the baby is born, only after and if it's reported to them. And I'll add that first responders are required to report such cases. Only then can they step in. And in this case, the baby is still in the hospital, and doctors tell us that babies withdrawing from fentanyl oftentimes have to stay in the hospital much longer, sometimes up to a month. David?
Up to a month. Blair Best in Southwest Portland tonight. Thank you, Blair.